Welcome to part 6 of aging. This last PowerPoint is going to focus on hearing changes in the older adult. The ear is the body part that allows us to enjoy the sense of hearing. The ears are located on each side of our heads, and the primary mechanism for hearing are protected inside of the head, even though what we think of as the ear is external. The external ear includes the auricle and the external auditory canal. The external ear is separated from the internal ear by the tympanic membrane. The auricle is made of cartilage and some fat and subcutaneous tissue. The auricle collects the sound waves and directs them down in the external auditory canal. The external auditory canal is a combination of cartilage and bone covered with a thin layer of skin with hair, sebaceous, and ceruminous layers and glands that are going to help clear out the canal with the earwax they produce. The middle ear is an air-filled cavity that has the tympanic membrane on the external side and the otic capsule internally. In the middle of this is the eustachian tubes that connect to the oral pharynx and the ossicles, which are the three teeniest tiny bones in our body. Those bones help transmit the sounds. Our inner ear is deep inside our bone. This is where the hearing organs live, the cochlea, semicircle canals, and the cranial nerves. This area is surrounded with fluid, and all of the tiny structures inside of the inner ear work to transform the sound waves into neural energy that travels up the acoustic nerve into the brain where it's interpreted as sound. In addition to hearing, the ears help with balance and equilibrium. To assess hearing and balance, the entire ear structure needs to be inspected. When we inspect the outer ear, we look for deformities, lesions, and discharge, as well as size and symmetry. We can palpate the external ear for tenderness. Assessing the tympanic membrane involves using an otoscope, which is not part of a normal nurse's assessment. The otoscope allows the provider to see the color of the ear canal, look for drainage, discharge, inflammation, or foreign bodies, as well as the color of the tympanic membrane and if there are any air bubbles, fluid, or blood in the middle ear. We can also do hearing testing acuity to see what sound frequencies the person can hear. Providers can use the whisper test, the Weber test, and the Rhine test, all of which nurses wouldn't do. Hearing loss is a very common disorder in America with many different causes. People can be born deaf or hearing impaired from hereditary disorders and may be acquired from infections, trauma, and chronic exposure to loud noises. We know that more men have hearing loss than women, and approximately 2% of adults aged 45 to 54 have hearing loss, 8% of those aged 55 to 64, 25% of those aged 65 to 74, and 50% of those 75 and older are going to have hearing loss. So hearing loss is absolutely an older adult issue. There are 3 types of hearing loss. Conductive hearing loss is caused by an external ear problem, and sensory neural hearing is caused by damage to the cochlear or vestibulocochlear nerve. And people can have a mixture of both of these. Deafness is the partial or complete loss of the ability to hear. Early manifestations may include tinnitus or ringing of the ears. They may have increased inability to hear when a group of people or when listening to the television. Higher pitched voices, like children and women, are harder to hear when hearing loss occurs. Hearing loss can be a gradual process where the person being affected may not even know it's occurring. Everyone around them can tell because they speak louder, they often ask for people to say things over and over again, and there may be changes to the quality of life that they haven't even realized. This can be behavioral and attitude changes and even safety issues, especially with driving and being a pedestrian. Some people refuse to accept the fact that they cannot hear and won't go get their hearing evaluated, or they may get it evaluated but refuse to wear their hearing aids. Older adults are prone to hearing loss due to changes in their cerumen, which is their earwax, which becomes harder and drier, which can cause impaction. The tympanic membrane may atrophy or become sclerotic, which means hard. The cochlea in the inner ear may start to degenerate, and a lifetime of hearing loud noises for an extended period of times can cause hearing loss. Hearing aids are the best treatment we have for adult hearing loss. However, there's a lot of things nurses need to be mindful of when we care for patients with hearing loss. We need to make sure that the patient knows we're there and then determine how the person prefers to communicate. We want to make sure we limit background noises like the television, and we want to speak in a low, normal speed voice and tone. We want to speak distinctively, making sure we say our words fully. We should face the person and not chew any gum or cover our mouth or turn away from them. If they prefer, speak into their ear that's less impaired. We want to use gestures and facial expressions if they help with communication. If necessary, we can write out the information we need to convey. And if the person has hearing aids, we need to make sure that they work and that they're in their ears. If the person prefers sign language, we must obtain a sign language translator for them. Legally, we must. And this is the end of aging and the end of hearing changes.